the 2014 Atlanta Press Club Loudermilk Young Debate Series, brought to you from Georgia Public Broadcasting. Now, the race for Insurance Commissioner.
Good evening, everybody. I'm Brad Means, co-anchor of WJBF's weekday newscasts in Augusta, and we'd like to welcome you and our live studio audience to the Atlanta Press Club Loudermilk Young Debate Series, originating from the studios of Georgia Public Broadcasting in Atlanta. This is the debate between the candidates for Georgia's Insurance Commissioner. Let's meet those candidates right now. They are, in alphabetical order, Ralph Hudgens. He's been the Insurance Commissioner since 2011. Liz Johnson is a longtime insurance agent. And Ted Metz is a U.S. Navy veteran and former GOP district chair. Now let's meet our panelists. Meredith Anderson is an evening anchor for News 12 in Augusta. Andy Miller is CEO and editor of Georgia Health News. And Michelle Worth is a reporter for 90.1 WABE. This debate will consist of 3 rounds. For more information on the rules, please visit atlantapressclub.com. It's a great source for that information. And let's get started. In this first round, the candidates will be asked one question from a specific panelist. Michelle Worth, you get the first question for Liz Johnson.
Ms. Johnson, you've spoken in support of expanding Medicaid under the Affordable Care Act. Your opponent, Mr. Hudgens, has actually been an outspoken critic. In your mind, why is Medicaid expansion needed?
Thank you so very kindly for that question. It is so critical because hundreds of thousands of Georgians, in fact, up to approximately a million Georgians are uninsured. And this gives those Georgians an opportunity to be insured. Thank you.
All right, Andy Miller, it is now your turn to ask Ralph Hudgens a question.
Commissioner, you've been an outspoken opponent of the Affordable Care Act, yet it's the law of the land and the exchange has been enrolling Georgians. Has your office been helpful to Georgians seeking coverage, or has it basically just sat on the sidelines during this process?
Thank you for that question, Andy. Of course we've been helpful. We follow the law of the land. My opposition to the Affordable Care Act is that the president promised that insurance rates were going to go down $2,500. He said if you like your plan, you can keep it. He said if you like your doctor, you can keep it. None of those have been true. And so we are doing what we're called to do for the Affordable Care Act, and that is to certify the rates. We can either say that a plan is too expensive, or we can say that it's adequate. And that's what we've done. And so we have done everything that we're called on to implement the Affordable Care Act.
And Meredith Anderson, you may now ask Ted Metz a question.
Hi, as a former Cobb County Republican district chairman, you recently worked on a Senate campaign for a Republican. Why did you decide to run as a Libertarian, and what impact does that have on your stance with the ACA and Medicaid expansion in Georgia?
That's 3 questions in one.
Oh, sorry.
To start with, after having been behind the scenes with the Republican Party, I just made the decision that I could no longer ethically, morally try to spread the liberty message within the Republican Party. The Republican Party seems to be extremely stuck on old paradigms that are no longer working. Now, the next part of the question was about the Affordable Care Act. As a Libertarian, the Affordable Care Act to me is an unconstitutional act to begin with. The concept behind it's very good, but the workings of it are very convoluted. What's the last part of the question?
Oh, I'm sorry. Medicaid expansion.
Medicaid expansion would work only if doctors were willing to take Medicaid patients, and if the Medicaid system actually paid the doctors when the doctors made their billings.
All right, very good. And that concludes the first round, believe it or not. Each candidate now is going to ask one question to the opponent of his or her choice. Each will have 30 seconds to ask the question, 60 seconds to respond, and 30 seconds for a rebuttal. Mr. Metz, your question for one of your opponents.
I would like to ask Ralph Hudgens a question. As an insurance commissioner, you have been in a position to inform Georgians about what is going to happen with the Affordable Care Act in Georgia. You've had since March of 2010 to inform Georgians about what the law was going to do once it took effect. Why have you remained silent?
Mr. Metz, I have not remained silent. I've probably made 100 speeches to various civic clubs, and every time I'm called on to give a speech and talked about the Affordable Care Act, and I've said that it's going to limit choices, it's going to limit the number of doctors, and the premiums are going to increase. And both of those statements have been very well legitimized by what's happening. The premiums have gone up dramatically, and like I say, the president said that if you like your doctor, you can keep it. That's not true. And he also said if you like your plan, you can keep it, and that's not true. And so I don't know where you get the idea that I have not been against the Affordable Care Act. I have very strongly.
All right. Did we have time for a 30-second rebuttal if you would care to offer one?
I would. What the question was is I have not seen any news media coverage of your speaking out to inform Georgians about the Affordable Care Act, other than videos online of you saying that you're an obstructionist, and then videos of you saying that you really have no authority to do anything with the federal law.
Now, Ms. Johnson, it is your turn to question the opponent of your choice.
Thank you, Brad. Mr. Hudgens, over the past year, your public statements and actions have been very unfavorable toward women. You've implied that pre-existing conditions like breast cancer were the fault of the woman. And you recently called out a female journalist who was roughed up and removed from a Republican event you attended. My question, given your unfavorable attitude toward women, why should the women of Georgia trust you to make favorable decisions regarding their insurance and their pocketbooks?
Ms. Johnson, I don't know where you got your information, but when I was talking to Augusta and I was talking to a Republican women's organization, and I equated a pre-existing condition to having an automobile accident, and that was not your fault, but then calling your insurance agent and say you want collision coverage. I was not talking anything about people with pre-existing conditions, because pre-existing conditions are beyond the person's control. They just happen, and I'm very sympathetic with people that have pre-existing conditions. When I was at the Birch Pumpkin Farm, the Nydia Tisdale event, I spoke. I left right after I spoke and headed to an event in Barrow County. So yes, I said to Nydia, I said, I don't know why you're videoing this. And then I made a further comment, but I did not have any objection to being videoed. I don't have any objection to that.
All right, Ms. Johnson, your turn for rebuttal if you so choose.
Mr. Hudgens, this being Breast Cancer Awareness Month, millions of women can take advantage of a free mammogram or women visit with no out-of-pocket cost. And this is all because of the Affordable Care Act, which eliminates pre-existing being denied coverage or higher premiums for pre-existing conditions.
All right, Mr. Hudgens, it is now your turn to question the opponent of your choice.
I will like to ask a question to Mr. Metz, but I think I know the answer. But Mr. Metz, do you agree with me that the Affordable Care Act needs to be repealed in its entirety and let the state of Georgia implement a program that will do the same thing as the Affordable Care Act, but not be as convoluted and not raise premiums?
Mr. Hudgens, I absolutely agree that the Affordable Care Act, I've called it a train wreck before in public, because when we really come down to it, the Affordable Care Act is nothing more than something that was put forth in order to tear it down and replace it with single-payer system, a healthcare system that has been in the play since 1996 when they passed the HIPAA law. Ever since then, they have been trying to get single-payer system out, and it's nothing more than a taxpayer giveaway to the big corporate interests who run healthcare. There are so many different ways we can give Georgians affordable health care. Several different models are already in place in other states. We really need to take a look and see how we can do that here in Georgia, such as the direct patient care model, which is like concierge care for the little guy. That would work, and that's all I can say for now.
All right, Mr. Hudgens, your opportunity to rebut Mr. Metz's answer, if you'd like to.
I don't think there's any rebuttal because I believe exactly like he does. The Affordable Care Act has not delivered what it promised, and I think we need to repeal it. And as he said, we need to come up with a state solution and not try to do an omnibus one bill that will try to fix every problem when it created many, many more problems than were there before.
All right, thank you very much for those questions and answers, candidates. If you are just joining us, this is the debate between the candidates for Georgia's insurance commissioner, and you can find all the rules at atlantapressclub.org. Now, we're going to go to our third and final round. In this round, our panelists will question the candidates until we run out of time. Andy Miller, you get the first question in this round.
This is for Mr. Metz. If you are against the Affordable Care Act and you're against Medicaid expansion, what would you do to deal with the well over 1 million Georgians who have no insurance right now? It's 20% of the population, and if we cut the ACA, it would increase. So what would you do about that to get people insurance?
First and foremost, let's take a look at our healthcare system, because it's turned into a sick care system. It's no longer about healthcare. It's about enriching people that have nothing to do with the individual care of the patient. Behind every doctor, there's probably 5,000 people standing behind them with their hands out, expecting a piece of the pie. They absolutely do nothing to contribute to the outcome of that patient's health. They only serve to increase the costs. There are so many regulations on the books that doctors have to adhere by in order to treat their clients and their patients. It's just ridiculous. One of the things that we need to do is we actually need to look at tort reform, because tort reform costs Georgians 25% of their health care dollars. We can replace tort reform with binding arbitration and get it out of the courts. There's also ways that we can implement other programs in Georgia to give Georgians health care coverage outside of the Affordable Care Act and outside of Medicare and Medicaid.
Thank you, Mr. Metz. And Michelle Worth, it is now your turn to ask a question.
Mr. Hudgens, you just said that we should repeal the Affordable Care Act and move to a state solution. What do you think that state solution should look like?
I believe the state solution would be to create a state-based high-risk pool. That was the big problem before the Affordable Care Act, and that's what everybody says is one of the greatest accomplishments. We need to have a state-based high-risk pool so people with pre-existing conditions can get that insurance coverage. But then we also need to allow the state to have high-deductible insurance plans, which a lot of people are not worried about the first $10,000 worth of their coverage. It's those automobile accidents that have a $75,000 or $100,000 cost that they need that insurance. But under the Affordable Care Act, you can't do that. You can't. There's a lot of things that the Affordable Care Act, the one solution for all the problems, has created, and we need to go back. We need to repeal it and go to a state-based solution.
Meredith Anderson, you may now ask a question.
My question is for Ms. Johnson. Rural hospitals in Georgia are closing. Some say as many as 15 could close within the next year, maybe the next 2 years. And it's leaving a lot of Georgians without a hospital, without an emergency room. What do you think needs to be done about that, and what do you think the problem is with that?
Well, obviously, it's quite a huge problem. And this is what I understand, Meredith, about all of this, including the rural hospitals. I understand that nearly 100,000 Georgia seniors and people with disabilities saved an average hundreds of dollars on prescription medications. Healthcare and insurance is a pocketbook and wallet issue for millions of Georgians. Putting the interest of Georgians first should be a priority. Those hospitals fall under that priority. My opponent, Mr. Hudgens, he won't fight for Georgians, but I will.
All right, we go back around to Andy Miller, your chance to ask a question of a candidate.
Commissioner, let's talk for a minute about auto insurance rates. Have they stayed the same, gone up, or come down in your time as commissioner? And what can an insurance commissioner do about an everyday pocketbook issue for consumers?
Andy, auto rates, according to insure.com, which is a website, it says that Georgia's rates are higher than the average. They use some very select precincts to determine that, select zip codes, and they use selective type of insurance. When in reality, the NAIC, the National Association of Insurance Commissioners, has done a study very similar to that, but they used a lot more data points and they used it on a lot more insurance companies. The truth, the reality is that Georgia in personal passenger auto is 1% less than the national average. On homeowners, they are, I've got that on homeowners, are 13.2% less than the national average. And on all lines of insurance, they are 2.4% less than the national average. The data that says it is more expensive in Georgia is false.
Now it is time for Michelle Worth to ask another question.
Ms. Johnson, do you find that to be the case? Do you think that the state has high auto insurance premiums? And if so, if you do think it's high, what do you think you could do about that if you were elected?
Michelle, thank you for the question. Excuse me. Yes, the car insurance rates are outrageous. In fact, pardon me, recently, pardon me, ladies and gentlemen, recently we were ranked number 2 in the nation with the highest car insurance rates. This again, for Georgians, is a pocketbook and wallet issue. So as a result of that, here we have again a situation where we must begin to put the interest of Georgians first. When we do that, lower insurance premiums across the board will take place. I'll put Georgians first. I'll bring everybody to the table to make that happen. Mr. Hudgens won't, but I will.
Meredith Anderson, your turn to ask another question.
I have a question for the commissioner. We've had a lot of people reach out to us saying, I am too poor for Obamacare, but I am too rich for Medicaid. And there's this gap of people who cannot get insurance, or they're telling us they cannot afford insurance. And I know you said you want to repeal the Affordable Care Act, but it is the law of the land. So what do you do with the people who are stuck in the middle? What can you do to help those 500,000 people?
Well, the Affordable Care Act ties our hands. We cannot let them have a policy that would meet their needs. They have to have the policy with every mandate in it, and those are expensive. And we are just certifying rates for next year. Last year on the exchange, Humana was the lowest price for a silver plan. This year, when they have filed with us, they have increased their rates 18.1%. And this is making it true what I said, that the coverage is going to be limited and the prices are going to go up. As far as the rural hospitals go that Ms. Johnson was talking about, that the Affordable Care Act is greatly responsible for those rural hospitals being closed. And Medicaid expansion, the governor has said that Medicaid expansion would cost the state $2.5 billion over 10 years. and frankly, the General Assembly cannot afford that.
All right, it is time now for Andy Miller to ask another question of our candidates.
Ms. Johnson, I want to pick up on the $2.5 billion cost of the Medicaid expansion. Explain what Georgia, you support that expansion. Explain how we can pay for it and then what Georgians would get as a benefit from it.
Thank you again for the question. Every Georgia citizen should have access to affordable health care, which includes the Medicaid expansion. While the opponent has focused on blocking affordable health care and denying Georgians with pre-existing conditions, over 300,000 Georgians enrolled in the first year. Again, I just want to remind you that my opponent, the incumbent, Mr. Hudgens, he just won't put Georgians first, but I will.
All right, y'all been coming at Mr. Hudgens pretty hard tonight, and Mr. Hudgens, we're going to give you 30 seconds to respond.
Okay, I'll just say to Ms. Johnson that instead of running for insurance commissioner, she needs to run for the state house or the state senate, because they passed House Bill 992 this last time saying that the governor cannot expand Medicaid without the General Assembly's permission, and then he has to sign that bill. So she's running for the wrong office, obviously, because I don't have anything to do with whether Medicaid can be expanded or not.
Well, that is all the time we have for our questions. Candidates will now have 60 seconds for a closing statement. And by random selection, Ralph Hudgens makes the first closing statement.
Thank you, Brad, and thank you for Georgia Public Television for hosting this debate. I am Ralph Hudgens. I am running for re-election. During the time of being the insurance commissioner, we have gotten for Georgia citizens $30 million worth of claims that insurance companies at first denied. So that's real Georgians getting real money because of our department. Secondly, our fraud division has gotten 60 different insurance agents and gotten them indicted for stealing money from the consumers. My first choice, or my first desire, is to protect the consumers in the state of Georgia, whether it be as insurance commissioner, safety fire commissioner, or industrial loan commissioner. My objective is to protect the consumers in the state of Georgia. So thank you for giving me this opportunity. I'd love to have your vote on November 4th. I am Ralph Hudgens.
Ted Metz, you may now give your closing remarks.
Thank you, and thank you for Georgia Public Television for holding these debates. I'd like to say that I have been a servant to my fellow man since I was an early child. I made an oath to do my best to do my duty to God and my country, and I've been making good on that oath ever since. I've been a licensed insurance agent in Georgia since 1989. I've helped thousands of families make the correct choice for their insurance. I did serve in the U.S. Navy. The Navy taught me how to pay attention to detail to find the problem with complex integrated systems and fix that one problem. We have systems in Georgia that are built on the industrial age mentality, and we need to fix them and bring them into the digital age mentality. There are a lot of things that we can do in Georgia to give Georgians affordable health care, make doctors whole, make doctors and patients' relationship private, and improve health care outcomes. Vote for me. I'm Ted Metz.
And Liz Johnson, it is your turn to give a closing statement.
Thank you to each one of you. For 40 years, I have fought to protect the economic security for consumers through their insurance. My opponent has brought Georgia the second highest car insurance rates in the nation, while accepting thousands in contributions from the industry he's sworn to regulate. He can't fight for you. I will. As an insurance veteran, I know the importance of access to affordable health care. With his public vow to obstruct affordable health care for Georgians who need it, Mr. Hudgens won't fight for you. I will. Being a woman in the insurance industry for 4 decades, I know how deeply insurance touches each of your lives. which is why you need more than a career politician in this office. Georgia needs a true advocate who's ready to bring the insurance providers to the table and get tough on insurance criminals. I am Elizabeth Liz Johnson. I ask for your vote and the honor to serve as your Commissioner of Insurance. I most humbly thank you, and I approve this message.
And that concludes our debate. We'd like to remind all voters that the general election is going to be held Tuesday, November 4th, and early voting is already underway. Our thanks to the candidates and to our panel of journalists. We'd also like to thank the Atlanta Press Club for arranging this debate. For more information about the Atlanta Press Club and all of the debates that they are hosting this election season, please visit atlantapressclub.org. This debate will be archived right there. The debate will also be available on demand at gpb.org. The Atlanta Press Club Loudermilk Young Debate Series is made possible by a donation from R. Charles Loudermilk. Please stay with us for the debate among candidates for Georgia's 12th Congressional District. I'm Brad Means. Thanks for joining us for the Atlanta Press Club Loudermilk Young Debate Series.
This is a GPB original production.